To the surprise of both doctors and patients alike, a growing body of medical research indicates that a lot of chronic pain disorders, as well as a lot of other common medical problems, are not actually caused by injuries or illness. Rather, they're the result of a complex interaction between the mind and the body. And it turns out that mindfulness practices can help us to resolve them. Let's start by looking at chronic back pain, which, oddly enough, we're discovering is not usually caused by damage to the spine or surrounding muscles. Although it's often thought to be an orthopedic problem, the accumulating evidence is that for the vast majority of sufferers, it's actually one of the more common stress-related medical conditions. So if you have chronic back pain and show up in the orthopedist's office, typically we're shown a diagram or a photograph of the back, the spine in particular. And what we see are a series of hard, bony vertebrae separated by cushioning discs. And what we're told is that these cushioning discs are kind of like jelly donuts. They have a firm outer compartment, or outer surface, and a squishy inner part. And that what happens with wear and tear over the years is that some of the squishy inner part bulges out, might break off entirely, and winds up pushing against nerves that run up against the spine, and that this is the cause of a lot of the problems. I was actually a chronic back pain patient myself once, and I can tell you that there's nothing quite like being told that your spine consists of a series of bony vertebrae separated by jelly donuts to give you a sense of its robust nature and to give you confidence that you can use your back in all sorts of different life activities. The other thing that we're frequently told we might call the orthopedic story. And this is the explanation for why it is that we have such enormous epidemics of chronic back pain in the modern world. And what we're told is that we originally evolved to walk on all fours, but in order to use tools and get fruit and the like, we learned to stand up. And now we've adopted all sorts of ergonomically unwise work postures, and it's these ergonomically unwise work postures that are giving us the trouble. Indeed, it does seem that there's an evolutionary accident that's responsible for our epidemics of chronic back pain. But it happens not to be this evolutionary accident. In fact, it's one that has nothing to do with structural damage. What it has to do with instead are the various factors and forces that predispose us toward developing chronic muscle tension. Now, when working with patients who have chronic back pain, it turns out that in order to help them begin to resolve the disorder, they have to first start changing their understanding of what's causing the disorder. Because as long as people think that the disorder is because their back is somehow damaged and that it's fragile, they're going to behave in ways that are actually going to perpetuate the other factors that maintain the problem. So I like to present evidence to patients from the research literature about the idea that most chronic back pain isn't actually due to damage to structures of the spine. Let me give you a few examples. One of my favorite studies involved doing MRIs up and down the spine of 99 people. And these were unusual people because these were people who had never suffered from any kind of back pain lasting more than 2 days in a row. And only about 20% of the population fits that criteria. And what they did was they did these scans and then they gave them to specially trained neuroradiologists to evaluate. And the neuroradiologists went to read the films, but the researchers didn't want to tip them off about what the study was about. So they took the films of these unusually healthy people and they mixed them in with people with chronic back pain, had the radiologist look at them, then looked at the results of the reads of just the subjects in the study. And they found that 2/3 of these people who had never suffered from any kind of serious back pain before had the same sorts of abnormal back structures that are often blamed for the pain. Then there are studies that show millions of people suffer from chronic back pain and they show no abnormalities in their backs at all. They go from doctor to doctor, they get multiple MRIs, and they all look clean. Finally, there are people who have abnormalities on their MRI. They go in for surgery. The surgery is a success. The only problem is the pain doesn't go away. And nowadays, surgeons will take a look 6 months or a year later, do a repeat MRI, and most of the time, the craftsmanship was fine. The back looks fully repaired. The only problem is that the person is still suffering. So what possibly could be going on here? Well, there are what we might call the smoking gun studies. Would you like to guess what countries have chronic back pain epidemics? Chances are, if you're watching this, the country you live in is included. Because it's the United States, it's Canada, it's all of Western Europe, although there something curious happened. Because when the Iron Curtain was intact, Eastern Germany had a low incidence, while West Germany had a high incidence. Then the wall came down, the Berlin Wall was taken apart, and the East Germans actually caught the disorder from the West Germans. Now that's curious. Looking for other areas that have this, the Pacific Rim, pretty much the entire industrialized and developed world has a chronic pain epidemic. If we ask the question the other way, it gets even more interesting. Who doesn't have this problem? Well, it turns out that people in the developing world have way lower incidences of chronic back pain than people in the developed world. In fact, a study by the WHO showed that Nigeria had the lowest rates of any country, and within Nigeria, it was the poor rural farmers that seemed to have the least pain. Now that really doesn't make a lot of sense if we think this is due to structural damage. I don't know if you've ever traveled in the third world, but the standard mode of transportation is usually a pickup truck with a couple of benches on the back, and people go jostling over rutted roads with their spines being shocked. There usually aren't even very good springs or shock absorbers, and they might go hours a day to get to market or to get to their fields. And these folks don't seem to have chronic back pain. They also don't have ergonomically designed workstations, and they don't sleep on Sealy Posturepedic mattresses either. That's very curious. Chronic back pain costs industry billions of dollars, so some companies have tried to study who's going to get it. And these are prospective studies. One of the best was done by the Boeing Corporation, and they analyzed thousands of their employees before they developed chronic back pain. And they looked at their psychological makeup, they looked at what their workstations were like, they looked at their health habits. You want to guess what the most robust predictor was for who would develop chronic back pain over the ensuing years? It didn't have anything to do with whether they had to lift things in the factory floor or sat in a seat on a truck or were hunched over a computer. Those factors weren't important. The most important factor was job dissatisfaction. People who didn't like their work tended to develop chronic back pain. Finally, there are studies that look at what's the quickest way out of acute rather than chronic back pain, in other words, short-lived back pain. And the quickest way out, in study after study, is a rapid return to vigorous exercise. Now, none of this would make any sense at all if the orthopedic story were accurate in accounting for our epidemic of chronic back pain. Rather, something else is afoot here. A cartoon about this that has two women facing each other, and one says to the other, "Honey, stress isn't par for the course, it is the course." So these are stress-related disorders. Now, what do we mean by stress? When we're talking about stress, we're basically talking about the activation of two very important systems in the human body. One of them is the activation of the sympathetic branch of the autonomic nervous system. You may recall that the autonomic nervous system has a parasympathetic branch, which tends to calm the body, and a sympathetic branch, which tends to arouse the body. The sympathetic nervous system is activated immediately when we experience ourselves to be in danger. Close on its heels is the activation of the HPA axis. That's the hypothalamic pituitary adrenal axis. And this is the hormonal system that pretty much does similar things to the activation of the sympathetic nervous system. It just comes in a little bit slower. So let's look at how these systems operate in a well-adjusted individual. Unfortunately, I wasn't able to find one among Homo sapiens, so we're going to have to use a bunny instead. And I want you to imagine a bunny sitting in a field, quietly munching on some grass. And let's just imagine that that bunny spies a fox at the corner of the field. He's going to have some very predictable psychophysiological responses. The bunny's ears are going to perk up. He's going to actually be able to orient them toward the fox. You know, bunnies look very cute when they do that. And his hearing will become more acute. He'll be able to hear better than he could have before getting aroused. He'll obviously look at the fox. He's likely to have the muscles at the base of the hairs all contract to make his hairs stand up That's to make him look big and ferocious. And if you think that's silly in a bunny, that's our goosebumps. You can imagine how many lions we've warded off with our goosebumps over the years. His heart rate's going to pick up. His respiration rate's going to pick up. His body temperature is going to go up. His blood pressure is going to go up. Same time, his digestion is going to tend to shut down. And of particular relevance for studying back pain is all of his skeletal muscles are going to tense because he's getting ready to do some combination of fight, freeze, and flee. Now, bunnies aren't particularly big fighters, so he's probably getting ready primarily to freeze and then run out of there when he gets his chance. Now, if the fox leaves, all of these systems are going to reverse. The parasympathetic nervous system is going to become activated. The HPA axis is going to return to baseline. And inside of something like 20 minutes, the bunny will look the way he looked before the fox ever arrived on the scene. But this bunny is a poor primitive creature. He has none of our capacity for abstract logic, for anticipatory thought, and for problem solving. If the bunny were sophisticated like us, he'd be able to think, I wonder where the fox went. Maybe he went back to his den to tell his friends about me. Or worse, maybe he's headed for the next field where my wife and kids are. Damn. Now, if the bunny were really sophisticated like us, he'd be able to think, gee, do I still have sufficient carrots in my 401k to make it into retirement? And other concerns. Now, this sets the poor bunny up for what we suffer with. And this is a whole host of disorders of chronic overarousal or dysregulation. This involves back, neck, and other chronic muscle pain, gastrointestinal distress of all sorts, upper GI distress of gastritis and things associated with too much stomach acid production, lower GI problems such as irritable bowel syndrome, headaches, temporomandibular joint disorder, which is pain in this joint here, tinnitus, which is ringing of the ears, bruxism, insomnia, eczema and other skin disorders, a whole host of sexual dysfunctions, and of course, panic and other anxiety disorders. Now, I'm not suggesting that all of these disorders are always caused by this overactivation or dysregulation of the fight or flight system. They can, of course, have independent medical causes. But all of these disorders can actually be caused either entirely by these arousal patterns, or, as is often the case, there's a medical component to it, and then there's this arousal component on top that exacerbates the condition. So let's look at how this might work in the case of chronic back pain, because a cycle gets established. And this cycle might begin with, let's say, an injury, maybe a minor injury such as overuse. Where I live in the Northeast, this often occurs sometime in December when the white fluffy stuff starts to fall and people begin to do this motion after having spent most of the year not doing that motion. And the back muscles start to hurt. Now, if a person is so unfortunate as to live in a country that has a pre-existing epidemic of chronic back pain, he or she may start to worry about the sensations of pain that arise in the back. When we start to worry, we start to have negative thoughts. And these thoughts bring with them fear. They may also bring with them a sense of frustration or even anger. And these negative emotions themselves affect the back. I want you to join me for a moment, if you're in a situation where you can do this, in doing a little bit of acting to see how these different emotions affect the body. We're going to begin with fear. So if you can join me in this, when I say 3, I want you to enact in your body what fear feels like. You don't have to call out, because it might not be appropriate where you are, but simply show the body sensations. Ready? At 3, we're going to do fear. 1, 2, 3. Okay, excellent. Now we're going to do anger. Ready? 1, 2, 3. Great. Now we're going to move toward frustration. And really join me in this so that you can see what's happening in your body. Do frustration. 1, 2, 3. And then finally, this is the kind of final exam for acting, show what it's like to have a feeling of anger, but not wanting to show it. Like perhaps you're frustrated with your doctor, or you're frustrated with your boss, or with your in-laws, or the cop has just pulled you over and you don't think it was fair. Ready? 1, 2, 3. Okay. Now, what was happening to your skeletal muscles in all of those conditions? I think you'll notice that in all of those conditions, the skeletal muscles tense. So we have this very interesting phenomenon in human beings, which is that our chief negative emotions, the ones we have the most difficulty with, all involve the tensing of the musculature. Now, tense muscles, we know, hurt. Have you ever had these muscles tighten up on your back? Or perhaps had a Charlie horse on your calf muscle and felt that tighten up? Tense muscles can be extremely painful. So, coming back to our cycle, tense muscles increase the sensation of back pain. This increased sensation of back pain increases the negative thoughts. Now I thought, uh-oh, it's getting worse. I've really damaged myself. And this goes off and running and becomes a whole cycle. After a very little period of time, almost everybody starts to give up activities because we don't want to re-injure ourselves. And then we tend to lose strength, endurance, and flexibility, and we get into a bad emotional funk. Now, sometimes this whole cycle gets going without ever shoveling the snow. It just begins with stress or tension from an event in our life that causes the tensing of the muscles and causes the sensation of back pain, and the problem takes off. Now, it's very important to resolve these disorders to recognize that the pain is not imaginary. Psychological stresses of all sorts can contribute to it, but it's not all in the head. Rather, it's the effect of changes in the musculature of the body. To my mind, an interesting story about Freud's history and how he came up with psychoanalysis that actually pertains to this. Freud originally trained as a research neurologist, and he wanted to be an academic. Actually, he wanted to study the sexual functioning of the giant squid. Now, this wasn't because he was some kind of oddball. It was because in the giant squid, there's a very large nerve that runs down the center of the squid, and in Freud's day, it was one of the only nerves that you could get electrodes into and measure. But he happened to be Jewish, and there were very strict quotas on Jews entering the academy, and he couldn't get a job doing research, so he decided he'll go into clinical neurology. And clinical neurology in his day was largely treating what we call conversion disorders. These are things like hysterical blindness or hysterical paralysis, situations in which the body is intact, nothing's broken in terms of organ systems, but we're experiencing it as though it doesn't work. Psychophysiological disorders are not conversion disorders. They're not about the body being intact, but us experiencing it as though it doesn't work. They're about actual changes, in this case in the musculature, or as we look at others, we'll see there are changes in the digestive system, change in blood flow, changes in all sorts of aspects of organ systems operating correctly. For people to get free from this, they need to see that it's real muscle tension that's doing it. So there are basically 4 steps that we go through to resolve these disorders. The first involves a medical evaluation. You know, I was taught early in my training that it's very bad form for a psychologist to psychoanalyze or do behavioral treatment for a brain tumor. If there's an underlying medical problem that can be addressed, you certainly want to get that addressed. And the same is true here. If there's kidney disease, if there's an actual tumor, something like that, obviously that needs treatment. Then the other steps are going to involve cognitive restructuring, which is shifting our thought patterns about this, exposure treatment, like we talked about with anxiety disorders, and then working with negative emotions. And as we'll see, mindfulness practices can help us to do all of these steps. We're going to do exposure and response prevention, only instead of treating our fear of snakes, we're going to treat our fear of movement. We're going to treat what's called kinesiophobia, the fear of using the body normally. And the way we do this is by resuming activities often enough to be convinced that they're not damaging. Now, there are a couple of ways to do this. One that's quite radical, works very effectively, and it's done in the gym. We could think of it as the weird science experiment gone awry. Here's what it looks like. There's industrial shelving, imagine this at about 3 feet and 5 feet, and imagine a gym filled with people. And what's happening is a new patient comes in and they're given a milk crate, a plastic crate filled with weights. And they're asked to just take this weight and aerobically put it on the middle shelf and the top shelf as quickly as they can. And to ignore everything that they learned in back school, everything that they've ever been told about being careful with the back. Instead, they're told to do it as a child would do it at 10 years of age who was in a contest, who was being paid or was going to win a prize for doing it as quickly as possible. This is a very fast method of getting over one's kinesiophobia. The problem is that it has a great chance of dropout because it can really scare people to start moving their back so vigorously if they've been so cautious up until now. Then there's a gradual approach, and that's where you simply begin with activities that are relatively easy, that are pleasurable or rewarding. There's no reason to start with something you hate, and that can be done 3 or more times a week. And the advantage of doing it 3 or more times a week is if the pain kicks up and we're doing it only once a week, we might start to think, oh gosh, you see, it's because I did that exercise, it's now causing me problems, and then we want to avoid the exercise. If we're doing it regularly, then the pain's going to come and go, it's going to fluctuate even as we keep up the activity. And you continue until it's no longer feared, and until you're convinced that it's not going to make the pain any worse. So now let's talk about mindfulness and the role that it plays in this. The Buddha spoke about this 2,500 years ago, and here's what he said. When touched with a feeling of pain, the uninstructed, run-of-the-mill person sorrows, grieves, and laments, beats his breast, becomes distraught. So he feels 2 pains, physical and mental, just as if they were to shoot a man with an arrow and right afterwards were to shoot him with another one, so he would feel the pains of 2 arrows. So let's take a moment. The first arrow is the moment-to-moment pain sensations, and the second arrow is this sorrow, grieving, lamenting, basically the resistance that we have to the pain. I was talking to a patient of mine who worked at MIT and beginning to outline basically the Buddha's message around this. And my patient said, as people who work at MIT often do, hey, there's a mathematical formula for that. And he suggested it's pain times resistance equals suffering. And I thought about it for a bit and I realized, he's right. If pain is very, very intense, let's say you've literally been shot by an arrow, even if you're a very good mindfulness student and you're practicing awareness of present experience with acceptance, unless you're really good at it, there's still going to be suffering. But oftentimes pain is in a more moderate range and nonetheless gives us a lot of grief. And if we can shift our resistance, it transforms the experience. Let me give you an example that's quite common where I live. In the late spring or the summertime, it's often very nice to go out on the porch after work. And during that period of time when the light is just golden and it's the time of day that the artists and the photographers particularly prize, and I might be sitting there with a drink or something to eat. And suddenly I might start to hear, and then we start the swatting, right? And it can be so bad as to drive me or whoever I'm with inside. Now, in the early days of mindfulness practices in the United States, sometimes we'd be sitting and practicing outside, let's say at a retreat. And the instruction was, don't kill anything if not necessary, and simply be with experience. And this was before concerns about Eastern equine encephalitis or West Nile virus, so mosquitoes in the US in those days were pretty harmless. And I remember several experiences in which I would be sitting, doing my meditation practice, rising, falling, being with the breath, and I'd start to hear and it's the moment when the sound stops that the trouble starts, right? And sometimes I could actually see where the mosquito had landed. Let's say it was on the back of my hand. And I'd see her, because it's the women mosquitoes that do this, would be burrowing her little proboscis, or whatever that front part is, into my skin, injecting the anticoagulant, beginning to drink, and you could actually see the back part of the mosquito expanding and turning red, and then she would fly off to make other mosquitoes. After a few moments, the little bump would start to emerge as the anticoagulant irritated the tissues of the hand. And the whole thing was not only not aversive, it was fascinating. It was like having my own National Geographic film happening right here on my hand. And this stood in such contrast to what it would be like on other occasions. I remember going camping at times when I'd get into the tent with my wife perhaps, and we'd zip it up, and we start to hear, and then the dialogue would start. Is it in the tent? Oh God, I think it's in the tent. Oh no, it's in the tent, we'll never sleep. Same mosquito, very different level of resistance. So what we learn through mindfulness practice is that pain can be observed as being separate from suffering. Impermanence is a gift, not just a curse. We notice that pain comes and pain goes. And apparently solid pain states can be observed like frames in a movie. We start to notice that they change from moment to moment. So we learn that pain is inevitable in life, but suffering is optional. Suffering comes from resisting the pain. And that's the grimacing, wincing, the bracing, all the aversive thoughts, the wishes for relief, when will it stop? The self-punitive thoughts, I never should have shoveled the snow, and the anger, fear, and depression about the condition. Now, there have been studies, neurobiological studies, that show that if we induce pain in a meditator responds differently than a non-meditator. Novices showed less activity in areas associated with proprioception, with feeling what's going on moment to moment inside the body, but more activity in areas associated with cognitive appraisal, with evaluating and thinking about and reacting to the sensations. The more experienced meditators had more activity in the proprioceptive areas. In other words, they were feeling the pain more vividly, but less in the areas of cognitive appraisal. So the experienced meditators actually felt the sensations more, but evaluated them and resisted them less. And when they were asked to report, how was that for you, the experienced meditators typically reported the pain as being at a much lower level than the novice meditators. So now let's talk about cognitive restructuring. Mindfulness, as we've discussed in other lectures, helps us to increase cognitive flexibility. And this is important because we need to believe or understand that beliefs are part of the problem. We need to understand that it's the thought, for example, that I'm orthopedically damaged that is part of what's inducing my fear, and that fear is causing the pain. So mindfulness can help us to be more flexible about this and to notice the relationship between thinking and the body's reactions. We can actually use it to observe pain-related thoughts, to notice how often a frightened thought comes into the mind about the back. And we can see that anxious thought and feeling is actually playing a big role in the disorder. We can also notice future-oriented catastrophizing. Oh no, what if I'm not able to work, etc., as well as the budgeting of activity. That's the thought of, I've already sat for 2 hours, I better cancel dinner, it'll be too much for me. We need to develop what's called creative hopelessness and acceptance and commitment therapy. You know the Chinese handcuffs that we had as a kid? You put your fingers in there and you try to separate them. What happens the harder you pull on them? The tighter they grip, right? This is the central paradox in the treatment of psychophysiological disorders generally. It's attachment to symptom reduction. Trying to feel better is what perpetuates the disorder. In the case of chronic back pain, what this is it's avoiding using the back normally because we want it to, quote, heal. That actually locks us into the cycle. We'll soon see that it applies equally in other disorders. Because we become subject to control addiction. We try desperately to get the problem to go away, to try to get the symptoms to stop. And what we learn through mindfulness practice, awareness of present experiences, acceptance, is that it's useful to control our behavior. In the case of chronic back pain, it's useful to go to the gym, but we can't control the sensations. The sensations are going to come and go like the weather. And this can be difficult given our cultural bias towards symptom relief because we're always being offered, take this medicine, take that medicine to make the symptoms go away. Instead, as we've discussed before, we're going to be increasing the capacity to bear experience rather than getting rid of experience. It should be quite clear now that we're not talking about relaxation training here. We're talking about changing our attitude toward the symptoms. And we increase symptom tolerance by doing this. You can simply sit, let's say you're doing breath meditation, and pain might appear in the back, and we can simply allow the object of awareness to move from the breath to the moment-to-moment sensations of back pain. If the back pain is really hard and we're having trouble bearing it, sometimes expanding the area, in other words, paying attention to, let's say the back pain is right here, we expand the area to go everywhere from the shoulders down to the buttocks. Embracing a larger area can make it easier to tolerate it. Now, finally, I want to say a few words about working with negative emotions. Do you remember Spock on Star Trek? I think his mother was human and his father was a Vulcan. And he was one of these guys who couldn't really talk about feelings very well. He had what we used to call alexithymia, which is no words for feelings. You might just call it being a guy sometimes. When we don't have words for feeling and we don't notice what's happening, we react with tension every time that some unwanted feeling comes up in our awareness. And this tension can actually contribute to these chronic stress disorders. Mindfulness practices, as we've seen before, can help us to notice all of these different thoughts and feelings, and as a result, to deal with these tensions better and not have them accumulate. Now, while mindfulness practices can be very helpful in working with chronic pain, they of course only work if we practice them. So once again, I'm sorry if I sound repetitive about this, but I encourage you to remember the challenge of how to get to Carnegie Hall. You have to practice and practice. And the more you practice these, the more they'll become useful tools for you to work with dealing with chronic pain and, as we'll see shortly, other chronic medical disorders that are caused by stress. In our next lecture, we're going to look at some of these stress-related medical problems that can be helped through mindfulness practices. And we'll also see the amazing power of placebos, how illnesses can become a doorway to psychological growth when we start to understand the effect that the mind has on the body. Thanks.